What should I do if I have advanced glaucoma? This was a question that was posed to me recently. Hi, I'm Mohammed Almal. I'm an ophthalmologist and I practice in Ocala and the villages in central Florida. Number one, if you have advanced glaucoma, what does that mean? We typically grade glaucoma as being mild, moderate, or severe. And essentially, what severe glaucoma is means that you have areas of vision loss both above in your superior field and below in your inferior field. So both the top and bottom of your visual field are affected by glaucoma. You may still see really quite well, but you have parts of your vision that are missing or extra blind spots. Severe glaucoma can also mean if you have blind spots or visual field defects that are very close to the center of your vision, very close to fixation. You may notice these yourself if you look through one eye. You may notice that parts of the vision are missing. In any case, we define severe glaucoma as someone who has, or an eye that has, defects in both the superior field as well as the inferior field, or has visual field defects or areas of loss of vision that are very close to the very center of their visual field or the very center of their vision. So that's what severe glaucoma is, or referred to as advanced glaucoma. So, probably the number one thing to do if you have advanced glaucoma is to have your intraocular pressure or the pressure inside the eye controlled. Typically, for patients who have glaucoma, in my practice, we try and achieve a pressure in the low teens. Of course, this depends on many factors. If the pressure, one of which is what pressure did the patient start at. Another factor is how thick the cornea is. But there are many factors that go into deciding what kind of intraocular pressure you need. And this is something that you should feel comfortable discussing with your doctor. So, if you have advanced glaucoma, we want to make sure that your intraocular pressure, or the pressure inside the eye, is well controlled. And that's been the number one thing that's been shown to prevent or delay loss of vision, which is the whole name of the game. When you have glaucoma, we want to preserve vision for as long as we possibly can, hopefully for the rest of your lifetime. So, number one thing, control the intraocular pressure. Have a good understanding of what your pressure is, what your pressure was before you started on treatment, and how your pressure is running now. Number two, if you have advanced glaucoma, you should be monitored regularly. Your ophthalmologist will set a regular schedule for when you are supposed to be coming in and having things checked. You'll want to have your intraocular pressure monitored. You'll want to have regular visual field testing, and you'll want to have regular scans of the optic nerve, such as your retinal nerve fiber layer scans, and many doctors also order ganglion cell layer scans. So you want to have regular visual field testing as well as regular imaging of the back of the eye to make sure that things continue to be stable. Number three, if you have advanced glaucoma, you're probably still a candidate for SLT or selective laser trabeculoplasty. You want to discuss that with your doctor. Am I a candidate to have some sort of procedure done to help control my disease process, not only through drops, but all through some sort of procedural intervention? More and more, we realize how difficult it is to use drops regularly, how sometimes using eye drops doesn't provide consistent intraocular pressure 24 hours a day, and where using a surgical procedure or a laser procedure may provide better control in patients who have advanced glaucoma. So, the other thing to consider if you have advanced glaucoma is, are you a candidate for glaucoma surgery? Are you a candidate for a surgical procedure to lower your pressure? So these are some of the things I would consider if for patients who have advanced glaucoma. Also, of course, if you have advanced glaucoma or any stage of glaucoma, you want to be diligent using any eye drops that are prescribed for you. Also, if you're put on any type of steroid, you want to make sure that that steroid, whether it's steroid nasal spray or steroid creams or ointments or steroid by mouth or even steroid injections into your joints, that these steroids are not raising the pressure inside the eye. So, these are just some of the things you want to keep in mind if you have advanced glaucoma. We want to make sure that you continue to preserve the vision that you have for the rest of your lifetime. Please drop any questions or comments you have below. Thank you for your attention. I hope this information was useful and helpful for you.